Good afternoon, everyone. On behalf of the National Glass Association, I'm Sarah Neiswanger, and I'm joined by my NGA colleagues, Melanie Detmer and Max Perlstein. And we thank you for joining us today for a special and unique Thirsty Thursday webinar in anticipation of September being Suicide Prevention Month. We have with us today a return speaker in Cal Beyer, whom you may remember from past presentations at Glass Build America and the most recent BEC conference. And with him today is Kevin Hines, filmmaker, author, mental health activist, and more. But before we go deeper into introductions, let's see what's happening around the NGA, and then I'll turn it over to Melanie to set the stage. So as you can see on screen, our events are now dipping into 2025. Two of our premier events that kick off the first quarter are the NGA Glass Conference, followed quickly by the BEC Conference. Sponsorship and engagement materials for both events will be available in the coming month. And so in the meantime, please just mark your calendars now to save you from having to remember later. Glass Build is nearly 1 month away. We're still wondering where did the time go, but registration is open to all at glassbuild.com. Sponsorship sales do close tomorrow, so if that's something you've been working through, we'd love to help you make your final decisions now. And as you register, please be sure to plan your travel to stay for the Magic of Glass after party. It's just $10 to add it to your registration, and proceeds benefit the NGA Foundation towards industry education and resources. I'm now pleased to turn it over to my terrific colleague, Melanie Detmer, to set the stage for our conversation today.
Thank you, Sarah, and thank you all for being here with us today. On a personal note, it was 2 years ago this summer that I found myself sharing my story about losing my little brother, Trevor, to suicide. He died by suicide at age 17. And the reason I was inspired to share this story of mine with all of my colleagues here at the NGA was we were talking about having a mental health and suicide prevention session at the main stage at Glass Build in Las Vegas that summer. And we ended up having a session at the main stage at Glass Build in Las Vegas that summer. And it's grown into working with Bob Swanson, Cal, just a ripple effect of initiatives and events and being resources and support out there for ourselves and our members. So thank you all again for joining. And with that, I turn it over to Max.
Thanks so much, Mel. And it is an honor to be here, an honor to be with these two gentlemen and talk with them for about the next hour or so on reflections of hope, suicide prevention in the construction industry. Joining today is Cal Beyer and Kevin Hines. Cal is a strategic business advisor focused on expanding advocacy for workplace mental health, addiction treatment and recovery, suicide prevention, opioid risk reduction, and overdose prevention. He's a ENR Top 25 newsmaker. He's been a speaker at our BEC conference and at previous Glass Builds, and coming this fall, once again at Glass Build. And there'll be more from what Cal does with his SAFE project at safeproject.us coming up in a moment. Also, Kevin Hines, he's a best-selling author, global speaker, and award-winning filmmaker. Kevin's work includes the book Cracked Not Broken, and the film Suicide: The Ripple Effect. In 2000, he survived a jump from the Golden Gate Bridge. Now he inspires audiences worldwide with his story of hope, healing, and resilience, teaching the art of wellness. He is now producing a documentary, which we'll be talking about more, called The Net, and we'll be getting into all of that here very, very soon. But to start, here's a quick video introduction of Kevin. Sarah, go ahead.
Are you okay? Is something wrong? Or can I help you? Those were the words that I desperately wanted to hear right before I catapulted myself over the rail. I have now lived 15 years past the day I should have died.
When you see a lot of mental illness being expressed, that's a clue that the culture is sick, not the person.
Hey, brother.
Hello, Kevin.
You were the first person to ever say, you know, Kevin, you should talk about this.
Our guest, Kevin Hines, plummeted 200 feet but survived.
Today, I traveled the globe spreading a message of hope. Why? Because we know it helps people heal.
There's a huge opportunity as we talk about stories of survival to support people who are out there who are in pain.
I break down on a regular basis. I have symptoms every day. I still have hallucinations, both auditory and visual.
Families of those who jumped from the iconic structure urged to stop the suicides.
One person goes to this bridge to die every 7 to 10 days. I think it's our obligation to stop it.
You go to Paris, go to New York, you go to Istanbul, there are suicide barriers. The more people that know about the horror of that bridge, the more pressure will be put to do something to stop it.
Will this really decrease suicides, you think?
They say things like, why ruin the aesthetics? What are the aesthetics of a bridge compared to one human life?
Kevin Hines, there's no telling how many lives were saved by you because you weren't able to take your own.
Let's get to that place that nobody is being brave who talks about their brain disease. They're just being honest.
My name is Kevin Hines, and this is my story.
Okay, we're going to dig more into Kevin in a moment, but just a reminder from Cal, some key mental health and behavioral health data points from the construction industry. You can see that on your screen. And of course, this recording will be available afterwards if you want to go back and review it. And if you want to see more of this information, we can get it to you, and we will also have some QR codes at the end. Also, 2 construction suicide prevention resources. Sarah, if you want to move to the next screen. There on your screen right there, as we talked about Construction Suicide Prevention Week coming up as a part of next month. And then the next slide, public safety announcement for you for Suicide Prevention Month. Again, all of this information will be available for you, but I want to really get to Cal and to Kevin as soon as I could here. And so let's start right now with questions for both of these gentlemen. First off, Kevin, thank you so much for being here. Your story and everything are so intense and so important. I'd love to know what your overall feelings were. Just going back to that day, and then the relief when when you tried and it didn't succeed. It was like they would say, like a whole new lease on life, I assume. Is that what the feeling was?
Well, I would first say this, and thank you very much, Max and Sarah and Melanie, and of course, Cal, and everyone at the National Glass Association. Thank you for having me. There is no such thing as a successful suicide attempt. And I know you know that, but I will tell you this. I felt the single most amount of despair and desperation that I'd ever experienced up until that point when I left off the Golden Gate Bridge. I believed I was useless. I felt I was worthless. I thought I had no value. And I truly, truly believed that everybody who ever loved me hated me and wanted me gone from this world. None of that was true, but I couldn't see it. I was stuck in a tunnel vision, and all I could see, feel, hear, touch, and know was pain. And I'll ask you, Max, and everybody on the call, a follow-up question, and that question is this, and I want everyone participating to consider responding either silently to yourself or responding aloud, even though I can't hear you. What is the one thing you want to happen when you find yourselves in excruciating physical pain? What do you all want that pain to do?
Go away.
Go away, stop, end, or leave. That's physical pain. My personal argument is that brain pain, what we all are so used to calling mental health and mental illness, is 300,000 times worse than any physical pain you may ever experience, because people around you invalidate it. Because they cannot see it, it must not be real. And so in all of that, the unrelenting, what I call lethal emotional pain, was so overwhelming
that I believed I had to die even though I didn't want to.
It's there's a lot. There's a lot there, and I know that you cover it, and there's so much to get to, and we're going to talk about that. But I want to go to Cal. Cal, somebody that a lot of the people in the industry know. You've spoken at a few of our conferences. How did you meet Kevin, and what was your reaction the first time you heard Kevin speak?
Wow, I still have the same reaction every time I talk to Kevin. I have a flashback to the inspiration that Kevin provides. And every time I've seen Kevin, he gives me that same hope. And Kevin, the way you tell stories, the way you weave it in, but that personal connection that we built. We have a mutual friend named Dr. Sally Spencer Thomas. And Sally is a behavioral health specialist that I was partnering with as a volunteer leader for the National Action Alliance for Suicide Prevention. We were partnering on the workplace task force, and I had just started a construction subcommittee. And I asked Sally to join me as a behavioral health specialist. And about 2 years later, she said, I'm inviting you to join a small select group of individuals who will be speaking at a White House event, a men's conference on health. And I was one of the opening acts. I was given 2 minutes, a quarter of a mile down the street at a Health and Human Services building. But Sally and Kevin were part of the main attraction. You saw pictures in that video, the ripple effect, and it showed the stage from that day. And Kevin, I intentionally sat halfway back in that audience because I wasn't sure what my emotions would be. But as Kevin described that brain pain, that emotional feeling, I went from goosebumps to my eyes welling up to gritting my teeth and biting my lip and pinching my leg. Don't be the guy who's crying today. And then, Kevin, I shared with you and Margaret when I had a chance to meet you, like, thank you for that release. Thank you for letting me recognize that this is normal feelings. I was grieving the loss of a friend from the year earlier, and I'd been doing suicide prevention work since 1992 to 94 in the workplace. But when I lost this friend, Jeff, it hit me harder than suicide in my extended family, my neighborhood, classmates, former coworkers, because I had helped Jeff. And I thought when he talked about faith fishing friends, and he was okay, and he wasn't. And I never felt guilt. And Kevin let me realize what Jeff was feeling, that he just wanted that pain to end. And it gave me this sense of relief. And it just empowered me as a leader to be bolder and to be stronger and to just push through the resistance. So, Kevin, you know, I view myself as an icebreaker. I try to set the table for people to talk about these things, but I met you January of 2016. I remember the date. I remember the hour. And then I had a chance to spend time with you and Margaret at Washington Reagan Airport. And we made a pact that day that we would find ways to collaborate in spirit and hopefully in person. And it's been one of the true privileges to know you, to be an advocate for your work, to share it now hundreds of times. And every time I share the website for the Kevin Hines story, I tell people, if you have a family member that's struggling, I want to give you the most meaningful story of hope. And it's a gentleman I'm now privileged to call friend, Kevin Hines. And then really quickly, Kevin, I wanted to say, I was talking to Melanie and the bravery and her courage. And I said, I want to introduce you to a special friend, because I knew you would be inspired by Melanie's story of losing her brother, Trevor. And then that's how you came to be part of our group today. And so that is the ripple effect in spirit and in action, right? We're all intertwined, and everyone has a role to play in suicide prevention.
It sure is. It sure is. And just for reference, you know, you mentioned Margaret. That's Kevin's wife, partner, best friend, and very important piece of this. And Kevin, you know, your shirt kind of says it really well. It's okay to talk. And Cal had made a comment there about when he heard you talk for the first time. You know, he was you know, wondering if he was going to, you know, show his emotions. How do you advise people with the standpoint of you know, being able to open up, that it is okay to talk, especially you're talking about the construction industry, which a lot of people, you know, try to put up a tougher exterior. And we're going to talk a little bit about what you went through, with the Golden Gate Bridge and people you ran into, but overall though, what advice and what direction do you give to be able to say it is okay to talk, no matter, what world you're in?
Well, I think first and foremost, before we go any further, and I'll answer that question about how to talk when you're in the construction industry,
Yeah.
and it can be such a place of great silence in the face of pain, right? As so many occupations can be, but specifically the construction industry. But what I would love to do before we go any further, if you don't mind, is consider all the people watching, listening, and that are going to listen and watch the recording later, who may have lost a loved one, like Melanie, like her brother Trevor, and like everyone who's lost someone. I've lost 18 people to suicide that I care about. And I would like to just have a brief moment of silence for all of us, for all the people we've lost this way, to honor their memory, to hold it dear, to never forget the light and the beauty that surrounded them when they were still with us, and to choose to hold what's so important, immeasurable gratitude for the very little time we had with them. I think if we go from there, I think it'll be really important. And I just like to just right now, very briefly, take a moment of silence for all of those that we have lost this way. Thank you very much. That I do that because it helps me with the people I've lost. And I know the feedback I get from people when they take that moment of silence all around the world in the stories I tell, they appreciate that to no end, because it gives them a moment to reconcile that the person they lost or loved that passed on by suicide or even attempted did not die or attempt because of them or in spite of them. They passed on by lethal emotional pain that had nothing to do with them. And to answer the question you asked, Max, about what I tell to construction workers or construction leadership about how to speak upon your brain pain, because that's what it is. It's brain pain. The brain is an organ just like every other organ in the body, and it too can become diseased. And so if you can just remember that think about it like this: if your other organs in your body become diseased, your liver, your heart, your lungs, your kidney, what happens? Everybody comes to the hospital with flowers and teddy bears and cards and love and admiration and care and empathy and compassion. But what happens the first time you end up in a psych ward? Where are people? Very, very few and far between to see you. And so to everyone struggling with brain pain, mental health struggles, any crisis, recognize that your pain has value because you have value. Your struggles are worthy of our time and others talk about it. And you matter simply because you exist. We had a 1 in 400 trillionth of a chance. Every one of us on this planet had a 1 in 400 trillionth of a chance to simply exist, to simply be born in the first place. That means you're meant to be here until your natural end, never to die by your hands. And so if you can recognize that in the face of great lethal emotional pain, you can find the resilience enough to stay here. Think about how resilient you already are. You're still here right now, even given the pain you've experienced so far. So keep going, because with time, effort, energy, hard work, and talking about it, you can be here tomorrow. And so if you're reluctant to speak upon your pain because of fear of being discriminated against, or pushed down or alienated, maybe it's not the first, second, third, or fourth person you speak to that's going to empathize with your pain, but keep going, keep talking, keep reaching out, because someone will be willing to answer the call. And I know this because it's been almost 24 years since my attempt off the Golden Gate Bridge. The same amount of time I advocated for raising the net or rail at the Golden Gate Bridge to stop the suicides there. And in those 24 years, I've done two things while living with regular thoughts of suicide. Two things I teach to people around the world. The first thing I teach people is to look in the mirror when you have the first inclination of a suicidal ideation and say these very effective words: my thoughts do not have to become my actions. They can simply be my thoughts. They don't have to own, rule, or define whatever I do next. Thus, you never have to tempt or die in the first place. Think about it like this. If all of our thoughts became our actions, Everybody raise your hand if you can when you answer this question. If all of our thoughts became our actions, pretend I can see you. How many of you would be in jail for road rage right now? You know what I mean? How many of you, right? Come on. So if we can recognize through the power of self-awareness techniques that our thoughts don't have to become our actions, they can simply be our thoughts, we never have to die by suicide. The second thing I do, and the single most important thing I do when suicidal in this two-pronged technique that I share with everyone around the world, is that I find someone, anyone, and I promise you, if I was suicidal today, I would turn to all of you and I would say 4 simple but very effective words. I need help now. I wouldn't fear saying them, and I wouldn't stop saying them until someone is willing to answer the call. And that is the difference between me and someone who attempts or dies by suicide, is that every time I have a suicidal inclination, I say I need help now, I get the help I need, and I stay alive. And so can you.
Absolutely. Thank you. Thank you. And Cal, I'm curious, again, keeping on the construction side of things, the first time you and Kevin shared a stage and you talked to construction related people, what was the reaction in the crowd? Again, I don't mean to make construction people sound like these hard, cold sort of people, but it is an audience that is a lot of times not very open. What was the reaction and how did it go forward?
It was Chicago, 2018. It was a large group of civil self-performing contractors, 32 of the nation's largest in that tough industry. And we'd had turning points, but not a true tipping point. And Kevin had said, I'm your righty in the bullpen. Play me coach when you need me. And so I never wanted to bother him. He was doing these big projects, his books, his films. But I called him with that. And I said, Kevin, now's the time. I need you. I wouldn't ask if I didn't need you. And he graciously came to Chicago. And that really started a number of associations and a number of these large companies saying, we can be a difference. We want to be part of that ripple effect. So Kevin, I remember us being on that podium. There was a gentleman who spoke that day who'd lost a child to suicide 30 years earlier. And he took a few of our minutes and we graciously said, please, your message is important. But when they heard his peer and then they heard me introduce Kevin and then Kevin shared his inspiring story, people were moved to action. And that was when this became a tipping point. And so we're grateful to Kevin. And Kevin, I shared with you a rivet that I'd been given by a contractor on one of the visits I'd had to the Golden Gate Bridge. And we've been riveted together symbolically. And then when you shared that as a gift, what that meant to you, just knowing that I'm part of your family, your army of helpers, right, is what I've been building, my army of helpers. So just grateful. You were what led to the tipping point.
Nice, nice. Kevin, can we talk about the power of lived experience storytelling? Because I think that's what kind of drives this, right?
I think you're right. And I think it's really important to consider what we're talking about here. Stories are 22 times more memorable than statistics or facts or even PowerPoints. When we tell a story, our neural pathways in our brain sync up with the storyteller, whether we watch it, hear it, or read it. The neurons in our brains actually connect with the storyteller's journey in a sense of true and the most deep kind of empathy. That's why when you're in a movie theater and let's say Batman hits a guy really, really hard, you feel a physical reaction. That's why movies are so powerful, because the art of storytelling and the science of storytelling is so real. When you tell a story like mine, with lived experience, with help-seeking and hope-seeking factors at the end of it or in between it or all throughout it, the people get that there's pain involved. They get that there's struggle. They get that there's strife and hurt, but they also get the humor and the hope and the heartfelt moments and messaging. I'll be very honest and transparent. When I first started speaking, back in the year 2001, I think sometimes I would leave people in pain. They would go home in pain because the story was so down. But over time, I learned how to talk about the story in a hopeful manner, with a lot of humor, and people really respected and responded to that. I've had hundreds of people come up to me and say, I thought I was going to walk into a death by PowerPoint, but I can't believe I laughed that much at a suicide topic presentation. That was silly, but really, they're appropriate jokes and they fit the narrative, and they're part of my journey. For example, I met my lovely wife, Margaret, in a psych ward. I was a patient. She was visiting her cousin. It doesn't get more hilarious than that. We had a debacle of a first date. When I asked her to date me, she gave me one first date, and I got lemon juice in her eye, boiling butter on her chest. I got marinara sauce all over my only good white shirt. It was an absolute mess. But she gave me a second date, and now we're 20 years together and 17 years married. And when I tell that full 20-minute story, people are barrel laughing. And so you have to show a moment from the brokenness to the hopefulness to the healing to the recovery. But I mention and I maintain that I'm not recovered. I am not well. I'm living in recovery one day at a time, like one would live in recovery from substance use disorder. It's just a different kind of relapse that happens to me back in the psych ward sometimes. So in all of that being said, it's very important that we learn to, if we have a story to tell in the construction industry and we've gone through something harrowing, if you have the passion and the drive and the ability, go forward and tell that story. It doesn't have to be on a stage like this, on a webinar like this. It can be to the guy who's struggling next to you, to the woman who's struggling next to you, to say, hey, I'm with you. I get it. And I got your back. And that could make all the difference in becoming the catalyst to saving a life. It's like I say in that opening video, we don't have to necessarily call ourselves sufferers, but we have to be honest about our pain. It's very important.
And a couple things. One is that the stat about stories versus statistics. That makes a lot of sense, probably in a lot of real life aspects, different business life aspects. So that does help you get the messaging across. And then I know that we're going to talk a little bit about the net and some of your other things, but the first date with you and Margaret, is that in a movie somewhere? Because that really should be.
So we are actually writing a screenplay right now with one of the top screenplay writers in the business, and we are going to turn it into a feature-length love story film. It's going to be a drama peppered with comedy. It's going to be powerful and very emotional, very moving, but very real. But it's also going to be very humorous and very fun.
Count me in. That story is another great takeaway. Very, very cool. Cal, I think we have to take one little step back because we keep talking about the ripple effect, but there may be people on the phone that may not understand that terminology. Do you mind explaining, what the ripple effect is and what it means for everybody out there?
And Kevin uses that phrase as well. I believed everyone had a role to play in suicide prevention. So working with that National Action Alliance for Suicide Prevention, we were trying to catalyze what could become a national movement. And we picked construction. Before there was data, we sensed that our industry was at high risk. So Sally Spencer Thomas joined me. We did research. We reached out to a lot of public health agencies. And the absence of data just reinforced our industry has risk factors. So I was talking about building caring cultures and how could we provide an empathetic and then a leadership that would be visible and vocal and vulnerable to help individuals. And I was talking about, I'm not going to stop until I see a tsunami of compassion. When Kevin did his presentation and he talked about being part of a ripple effect, I was like, wow, this imagery just spoke to me. And Kevin, when I read, Cracked Not Broken, powerful story. And when we got a chance to see your film, The Ripple Effect, my children were mesmerized. They saw the work I was doing. They saw you as truly a superhero, a person who'd overcome these incredible odds. You lived and the strength you had. And so I was describing, Max, to my children how we're all part of this ripple effect, and we can tell Kevin's story and we can give people that hope that he gives in a smaller dose, and it won't be as concentrated. But Kevin has been an inspiration to millions. And Kevin, just the number of people that you've reached with the ripple effect film, you probably know the data off the top of your head. But I want to say it's a very large number.
Yeah, it's been seen by over 3 million people in 20 plus countries. Over 1,000 people have said the film saved their life. But my videos across all platforms done by other groups and myself combined have reached over 3 billion people, and over 200,000 people have written into those videos and said these or this or that video saved my life. And that is a gift I will never take for granted. I'm not a lifesaver. I'm a conduit. We all are. We give a message. People go home. They do the work. They're saving and changing their own life. They're telling for the first time their loved ones what they're going through. They're talking to their doctors for the first time. They're talking to their therapists for the first time. They're hiring a therapist for the first time, and they're asking for help, and they're getting it, and they're staying alive, and they're fighting the good fight, and they're being here tomorrow, which is just incredible. I feel moved to the core that this one story has had that much of an effect.
It is. Cal, did you have something to add? Sorry.
Max, 3 billion individuals. I think about individuals who have big reach, but I've not heard anyone approach that 3 billion number. And Kevin, it's just phenomenal. That impacts me. Thank you.
Very much so. We're about halfway through, a little past halfway through on this. If you do have questions, you can put your questions in the Q&A section. And before we're done, we will, get them to Kevin and Cal to answer. So please do that. And just to reset, if you joined us late, we're with Cal Beyer from the SAFE Project, safeproject.us. And we're with Kevin Hines, who's a best-selling author and filmmaker. And as you can see on the screen, at Kevin Hines Story is the social. You can scan the QR code, kevinhinesstory.com for more information. And of course, he has the book Cracked Not Broken, and the film Suicide, The Ripple Effect. And he also now has a new documentary in process called The Net. And those of you who were with us at the beginning saw a clip of that. I assume that was from the Net, right, Kevin? That wasn't from your previous documentary, or was it?
That clip was from the first documentary, Suicide, The Ripple Effect, and the outro video is the trailer to The Net, which we're going to see at the end here.
Okay, great. So can we talk a little bit about The Net? I saw a snippet with you a couple weeks ago when I met you. Incredibly moving. It's in process. Where are we at with that? And really, I know why it's so important to share with the world, but what was your thought processes on being able to share it with the world?
Well, let's really dive in, because this is really an important topic. So
yes,
for the better part of 90 years since the bridge was opened in 1937, the Golden Gate Bridge, after its amazing construction and its Art Deco masterpiece, the rails were lowered to 4 feet. They were supposed to be 14 feet tall. They came with the Art Deco construction. They lowered it to 4 feet so people could see over the rail. Joseph Strauss famously said, "No one will ever die here. It's just too beautiful." He was quite literally dead wrong.
Wow.
And over the next almost 90 years, there were a total of 7 efforts to stop suicides at the Golden Gate Bridge. The first in 1939, where the bridge patrol of that era tried to raise the rail. All of those 7 efforts failed. The current effort, literally founded by my father, Patrick Kevin Hines, who founded the Bridge Rail Foundation at bridgerail.net, with Paul Muller and Dave Hall. Paul Muller was an activist and advocate. Dave Hall lost his 13-year-old daughter, Kathy, to the bridge.
Oh.
And I was a co-founding board member alongside my wife, Margaret. Dana Whitmer was a founding board member with her husband at the time, Mark, and their son Matthew died off the Golden Gate Bridge. So many other people got involved. So many other organizations and groups got involved. But we were a catalyst, and we pushed the message forward. And for the better part of 23 years, we fought to raise the net at the Golden Gate Bridge, originally the rail, then the net, because people were complaining so much about making a tall railing and ruining the view, ruining the aesthetics of a bridge. What, as I say in the video, what are the aesthetics of a bridge compared to one human life? Someone you love unconditionally. And so we fought and we fought and we fought. And I say that purposefully, fought, because the Bridge, Highway, and District Authority fought us viciously at every turn. They were brutal. Let me explain. For example, when my father, Patrick, was giving his 3-minute allotted testimony in front of the board that runs and owns the bridge, and he said on that board meeting table, why don't you re-raise the toll for walkers on the bridge or passersby on the bridge or bike riders on the bridge? My son had no money when he went to the Golden Gate Bridge. He didn't have his wallet. He wouldn't have been able to even get a step on the walkway. And a woman stood up and she said, Patrick, more people die of sedentary lifestyles than die of suicide.
Oh, wow.
And he said, Leah, I like ice cream. Do you know how to roller skate? And she said, that's preposterous. And he said, and so are you. And it made the nightly news. And when I got up and I said my 3-minute allotted testimony at one of the different meetings, I said, look, there was a 4-year-old toddler in a stroller, unbuckled into the stroller, fell in between the crack between the walkway and the traffic and the bridge walkway. There was a gap back in the day. The kid fell through. Of course, the child died, and the parents sued the bridge, and they closed that gap within 2 weeks with no public comment. What I said at the meeting was, why won't you do something like that with the rail or net for someone like me? And another of their board members stood up and said, because that child was innocent.
Wow. Wow.
They were brutal. And so it was a fight. And they would like to tell us that 1,800 people have died off the Golden Gate Bridge even today. That is a blatant lie. The bridge patrol officers who see the deaths, the Coast Guard who see the deaths, the Marine coroner who sees the bodies says when the Golden Gate Bridge District says to you that's 40, 30 people have died, it's more like 60 or higher. They're just not counting that many. They don't count you if you wash away to sea. They don't count you if you're eaten by fish to the bone, which happens all the time. They don't count you if you only find 60% or less of the body. And they don't count you if they find your note in your car or your bag on the bridge, but they don't find your body.
Oh, wow.
The number of people that have likely died off the Golden Gate Bridge, and no one wants to talk about this, is more like 4,000 or higher. And I believe it's higher. So we fought for all these years to raise the net. And because of the Bridge District Authority, thank goodness for their turnaround and their come to Jesus moment, if you will, and because of the pressure we put on them, they weren't just going to do it out of their own kindness and their own hearts. They did it because we forced their hand. But thank you to them for finding a great many of the funds. Highway and transportation funds were used. Caltrans funds were used. Prop 63 funds were used. And the Bridge Rail Foundation found a lot of the funds. And so it was a team effort by all, of course. And this film that we're making, The Net, is about the harrowing near 90-year story of ending death at the Golden Gate Bridge, all the people that remain alive that were involved. There's a woman named Eve Meyer. She was the head of San Francisco Suicide Prevention. She's in her 80s or 90s. She has been fighting for this for over 30 years.
Mm.
She is the longest surviving or alive member of the fight for this cause. And she got to see it happen, which is beautiful. And the interview with her is palpable. And so we're 10% shot. We're looking to shoot the rest of the film. We're looking for finishing funds to complete the film because it is a large endeavor. But this is a really huge story. And we're also covering the story of some of the construction workers that are involved in making the net real physically. Because what people didn't realize and what the Bridge District Authority tried to hide was that when these guys are out there building the net, they didn't close the walkway, which they should have done immediately. People were still jumping over to their death right next to those workers.
Oh.
Well, some of those workers were going home and taking their lives afterwards. And that's something nobody talks about because of what they saw visually.
Yeah.
Because they're shock and potential PTSD. And so we want to cover those stories appropriately and kindly. The next thing we're covering is a particular Coast Guard officer who has seen 57 deaths at the Golden Gate Bridge. He's a personal friend of mine. He actually helped save my life out of the waters. And there's a story he hasn't told that he's going to tell in this film. And it is going to change your mind if you're thinking about suicide, and it's going to change your life if you're thinking about suicide.
That's great. That's I look forward to that. Now, for the people you mentioned, you're about 10% in. You're raising funds to continue, because we know filmmaking's not easy, not cheap. How can people contribute? Is it a Kickstarter sort of thing? How does the contributions work?
It's very simple. And I'll put this, and before you get this QR code, make sure you copy this QR code on the screen right now and save it to your phone. I will put this on that QR code today. Give me about 10 minutes after the call. Go to thenetmovie.com, and that's all you need to do. Go to thenetmovie.com, and you will find the ability to give to the film. You'll get a special thanks on the film's website. And if you give, this is a large ask, but if you give over $200,000, you can actually become an executive producer on the film.
Gotcha. Very, very good. Thenetmovie.com to do that. And again, we will see a little bit of a trailer of that before we wrap up here today. And Sarah also put that in the chat so everyone can see. We've got a few questions that have come in as well. And so if you don't mind, first off for you, Kevin, does architectural design influence suicides? So obviously the Golden Gate Bridge almost invited it, like you had mentioned the rails coming down. But does architectural design influence suicides?
I really believe the fact that it was a 4-foot rail, ease of access. I'll say this, ease of access to lethal means encourages suicide. If you make it easy for someone to die who is in the greatest despair of their life, they're going to go to that location and they're going to attempt to take their life. And it has been so for all these 90 years. It's the most frequent spot for suicide around the world, no matter who tells you otherwise. Let me make it even more clear. Since the net's been in place, suicide attempts have reduced by 83% at the Golden Gate Bridge. And there's already been a 3-month period back to back where there were 0 suicides at the Golden Gate Bridge for the first time in almost 90 years.
Wow.
Is incredible. Yeah. That's the greatest case study of reduction of access to lethal means I've ever heard of. And what we needed to do, and this is what the film is all about, the net. It's going to be a palpable story with help and hope-seeking factors that is going to show the world that if you are a mother or a father or a loved one who's lost someone to suicide, the opioid epidemic, the fentanyl crisis, you can do something to change legislation here so we can do it everywhere. It's a call to action to change the world.
Tremendous. Cal, I know you have some thoughts on this.
So, Kevin, thank you. I think the practical applied answer you gave to the reduction already with the advent of the net, that's the proof point. But there is reasons why this is a construction industry, not just our high rate of suicide, the fact that we're problem solvers and we're fixers. And if we involve the whole AEC, architectural, engineering, and construction industry, we can have a tremendous impact. Yeah. Kevin has knowledge of this as well. But there are other industries that and facilities that do get used as a lethal means for suicide. We've seen train yards and train tracks, and we've seen bridges. And so there are parking lot structures as examples. And there have been some architectural considerations. There have been some design considerations. I think Kevin would probably agree. It's hard to say something would be perfectly suicide proof, but suicide resistant design is definitely where we're moving toward. And I'm seeing that with DOT agencies, I'm seeing it with railroads, and I'm seeing it with other physical engineered systems and structures. So I think what's powerful is every one of us who has an idea, if that's our calling, if that's our gifting in life, please think about applying that with this knowledge and sensitivity that we've developed. I remember a company, they've taken a real active leadership role in suicide prevention, but they were building a parking lot structure. They'd reached out to me. I sent them what at the time was a leading set of design standards. And then they actually enhanced upon that minimum design and said, we can do something more and we can address aesthetics. So Kevin, it wasn't an either or, they made theirs a both and. It was powerful. And they took it upon themselves with their initiative saying, we can do more. So that was a great question. It's not something we often get asked, but I think it's really relevant with what the net is featuring.
Well, and I think as a follow-up to it, we had a question that asked, should building codes incorporate anti-suicide requirements? Like they should be, a little proactive at this point.
I believe that. I believe that wholeheartedly, because when we're building going forward, you need to consider that there are so many people, both in the construction industry and then people who just potentially will work at that location, who will be in brain pain and will attempt to take their lives off of that location. So why not eliminate the access to lethal means before you, as you create the project? I didn't stop at the Golden Gate Bridge. We did some work with the Natchez Trace Bridge, the Cold Spring Canyons Bridge, the Bloor Street Viaduct in Toronto, Canada. We did. You have to think of these things when you're in construction, and consider the people who can't care for themselves.
Right.
It doesn't mean they're less than or worse off. It means they're struggling, and we need to think about them in our building.
And on that, any opinion on the vessel in New York City? Because that seems to be one that has attracted, unfortunately, suicide attempts and suicides.
Yeah, it did, but as it's my understanding that upon the fourth suicide, they locked it down. Upon the fourth, how did the Golden Gate Bridge get to potentially 4,000 or more? When New York, nope, we're stopping it right now. Yeah. And it's people have to use their heads and realize that there are a lot of people, millions of people in the greatest despair of their lives right now.
Yeah, that's I did not know that after 4. That's amazing, and it kind of plays to the story that you had about the child at the Golden Gate Bridge and how quickly they fixed it. We had a question in, and this is both for Cal and Kevin, and it's again, you had mentioned earlier about I need help now, and talking about it, and the person who asked is, how do you tell your spouse or someone you love that you want to die? Do you have any thoughts on how to handle that? Obviously, it's a tough one, and it's a little different than in a coworker situation. Cal, do you want to start with that one, and then we'll go to Kevin?
And real quickly, Max, before I do that, just because that other thought on the architectural and design, I'm a risk and safety professional, and one of the movements that's really excited me is this move of safety through design, and that is combining the outcome and the design, moving it upstream. That's powerful. That's what we're seeing. I agree, like Kevin, building this into building codes would have a big impact, especially on these landmark civil structures that have size and scope and easy access.
Yep.
But on the question of what can we do if we need help, Kevin's is the most direct.
Definitely, yeah.
And I think what I'd like to just share too, what's helping is we're building this army of helpers. We're teaching people different methods of gatekeeper training to be able to recognize the signs of emotional distress and then equip people with what questions to ask. And then how to break down the barrier if someone says, no, I'm fine. Well, it doesn't seem like you're fine, without getting in their face. So while that's occurring, then empowering individuals who are expressing emotional pain, that it's okay to not be okay, that help is available. And so I think the more we are hopefully messaging and we're letting people know that we care we have their back. Kevin, you use that phrase, that I'm here for you. Call me anytime, day or night. Letting people know that we see them, we hear them, we feel them, and we're there for them. That gives people comfort and confidence that they're not alone. And Kevin, I'd like to hear your response, and I might play off this one more time.
Yeah, because Kevin, this is a tough one. When it's a husband to a wife, wife to a husband sort of thing. I mean, do you have advice? Do you have insight on that?
Yeah, so I consult with people around the world who are going through this type of problem with their husband and their wife and their loved ones. One of the things I suggest doing is writing a letter. It's very hard to vocalize suicidal ideation for fear of judgment. So people silence their pain and they pretend and they bury their struggles. But it's much easier to write down all of your thoughts and all of your struggles in sequence and say to your loved one, your husband, your wife, your fiance, whoever, your significant other, I need you to read this, and I need you to read it without judging me or my struggles, because I need your help and I don't know how to properly ask for it. Please read this letter, and then let's calmly talk about it, because I'm in a lot of pain and I don't know what to do. And when I've had couples come together and read their letters, what I often ask the second person is, after you read that letter, write a kind, compassionate, loving, caring, non-judgmental letter back. So it's a different medium than just talking to someone. You're getting out all of the feels in this letter, and someone is responding with all of their hope and healing and help. And then what I say to do is to take action to physically make sure that suicide is not an option in that household. This idea I had is not born from me. It came from Dr. Jerry Motto, who wrote the Caring Letters with his wife, Pat. Dr. Jerry Motto, among other things, was at one point at San Francisco VA hospital when he was there, managing psychiatrists, head psychiatrists. And he and Pat realized that patients were leaving the hospital because of HIPAA privacy laws. They were wandering aimlessly, attempting again, potentially dying. There was no follow-up. There was no follow-through. In the 1970s and 80s, he started writing the Caring Letters. And the Caring Letters would go out to all the patients, a few paragraphs about how much we care about you, we believe in you, we know you can get better, we want to help you still even after your psych ward stay. How can we be beneficial to you? What do you need from us in your struggles? Well, guess what? All these letters came back saying, thank you so much for showing you care about me. Why do you think reduction of access to lethal means works? It's because you show someone you care. Telling someone you care can go in one ear and out the other. Physically showing someone you care makes all the difference. These letters, 3 to 5 people in the family started writing these letters to people, caring letters. You get 3 to 5 letters that say the same thing in different messaging, in different words, with love, compassion, care, empathy, lack of judgment. And it changes their world because they can read that letter over and over and over again. Think about what the company Cope Notes is all about, right? The company Cope Notes by Johnny Crowder is all about sending randomized text messages to people in pain so they can keep going. That's basically a digital version of the Caring Letters. So there's all kinds of ways to incorporate this in our lives. And I believe that if you're really struggling with suicidal crisis and you have the ability to write it down, even if it seems a little fractured, so people can see it and get you the help you desperately need and so deserve and so desire.
Well said, and really amazing. And we're pretty much at time, but I want to, Cal had sent me a note that you, Kevin, are a huge proponent of caring letters and caring messages, the expectancy of healing and the availability of support. And so there's also Cope Notes. It's a daily subscription service that can be gifted, which we will get that info out, thenetmovie.com. And so as we're getting ready to wrap up, there are going to be more details and more resources available at glass.org. We obviously will have Cal at Glassbuild, but Sarah, why don't we go ahead and run the video of the net, and then we'll be back to wrap things up.
But before you do, can I say one more thing?
Sure.
Okay, so everybody watching right now, and everyone's going to watch, just let you know, go to that QR code again, go to my website, get yourself some of our merch, because 100% of the proceeds go to Zero Suicides every year. So please get those, because when you wear these outside, it starts a conversation with people and gets people talking about their mental health, and it's an incredible feeling.
Consider it done. Absolutely. We will do that. And Sarah, go ahead and run the video, and we will continue.
Somebody had to take a personal stake in the issue. It's like any other issue or cause. Until some group or organization takes it on as a personal issue, it's very hard to raise public awareness.
When Jacob died, I knew that I had to get out there and make what happened in his life and in his death make a difference in the world. And I went, we got to fix that stupid bridge.
There was a lot of resistance from the sitting members who said it was built to look this way, and it would be a travesty to change the aesthetics of the bridge.
The California Highway Patrol asked the Bridge District to resolve the matter in 1939 after there had been 11 suicides. The point of this is to restrict easy access to lethal means. That's what the net reflects. And the more we can get the word out about restricting easy access to lethal means, the more we're going to get suicides reduced.
In my humble opinion, this will stop suicides at the Golden Gate Bridge. I'm not doing this just because it's dollars and cents or whatever. I'm doing it because, damn it, we need to change this. We need to stop the carnage. Please help us stop the carnage.
It's a beautiful structure, and it's an Art Deco masterpiece. That's not safe.
We all came together. That's what's so powerful about this. And we changed public policy. We did it here, we can do it anywhere. And we're saving lives. That's what counts. If it's just one life, that's all that matters.
Well, thank you, Kevin. The netmovie.com. We will make sure that we continue to pass that along, and then there's a couple more QR codes up on the screen. And then next page, Sarah. Industry resources that you can also find from the Construction Industry Alliance for Suicide Prevention, Construction Suicide Prevention Week, and then NGA articles for you coming up as well. And Sarah, I don't know if you want to close things out, but I just wanted to thank Cal and Kevin. I know it was a quick hour; it flew right by. But I think this is, as we've seen with Cal, he's been at several events. I think this is the start of things that we can continue to educate our industry on what's going on, and it's just not the last time we're seeing your face, Kevin. That's for sure.
Thank you all so much. Thank you, Sarah, Melanie, Cal, Max, everybody watched. Thank you.
Thank you. Mel, Sarah?
Sure. Thank you, everyone. Again, and just a reminder, we will be bringing Cal and Dave back this fall, September, in Dallas to continue the conversation on recovery safe workplaces. And again, thank you all for joining us, and have a great day.
And one last reminder, if you are interested, the recording for this presentation will be available on our website in the coming days. And we hope to see you again at Glassbuild and also on September 12th for our next Thursday webinar. Thank you again to Cal and Kevin. We really appreciate you being here. Have a great afternoon.